All right, for the first time, children 5 to 11 will be able to get a kid size, as they're calling it, version of Pfizer's COVID-19 vaccine. The announcement by the CDC director, Rochelle Walensky, came only hours after an advisory panel unanimously decided Pfizer shots should be opened up to the 28 million kids. Wrap your mind around that. 28 million kids in America in that age group. So today we spoke with Dr. Jane Kelly on why this vaccine is so important for kids.
The risk is too high and too devastating to our children, and far higher than for many other diseases for which we do routinely vaccinate children. And I think that's a very important point to understand. The illness and death that a child could experience from COVID-19 is statistically higher or more severe than it is for other diseases for which we already routinely vaccinate our children.
Well, millions of shots made by Pfizer and its partner BioNTech have already been shipped to states, doctors' offices, and pharmacies right here in South Carolina. So conceivably, you could get your young child, age 5 to 11, vaccinated as soon as you like. Call your doctor's office. And speaking of calling your doctor's office, we are so excited to have Dr. Lauren Matthews, a pediatrician with Lexington Medical Center, back with us today. And I'm sure you will start giving these shots out very soon. Why is this something parents of children ages 5 to 11 should do?
This is absolutely such an important vaccine for our children ages 5 to 11 to receive. We know that vaccines are the best way to help prevent illness, but also hospitalization and potential complications that may arise from contracting COVID.
Dr. Matthews, would getting this vaccine interact negatively with any other child immunizations that are required?
No, in fact, we're in the beginning of vaccinating for the influenza virus, and so you can receive the flu vaccine and the COVID-19 vaccine at the same time. It would just be in different sites.
For many people who are still worried about side effects, that's something I've heard from friends with kids in the age group. They're worried that there'll be some negative side effects. What do you say to ease parents' concerns about giving this vaccine to a child as young as 6 years old?
This vaccine has been well studied, obviously in the 5 to 11-year-old age group, but also in the millions of vaccines that we've already given to adults across the country. And so we really have to trust the scientists that are looking at this vaccine and its safety.
Dr. Matthews, is there a child ages 5 to 11 who should not receive this vaccine?
There are some children that will have contraindications to this vaccine. The number one is a child that has a previous anaphylactic reaction or allergic reaction to any components of this vaccine.
All right, Dr. Matthews, thank you so much for your time tonight and your knowledge. And when do you at Lexington Medical Center expect to start giving these vaccinations out to younger children?
We will begin vaccinating children in the 5 to 11-year-old age group at our community site tomorrow, which is Brooklyn Baptist Church.
Wow, that is exciting. Well, there you go. Tomorrow at Brooklyn Baptist Church, you can take your children ages 5 to 11. Thank you so much, Dr. Matthews, for your time tonight. We appreciate it.
A number of pharmacies are planning to start kids' COVID-19 vaccinations at several locations starting this weekend. CVS, Walgreens, and Rite Aid are among the major chains that plan to start vaccinations for kids as young as 5 in the coming days. Pediatricians' offices and hospitals also began inoculating kids on today, with schools and other locations planning to follow suit in the days ahead. We have details on how you can schedule vaccine appointments at local pharmacies for your child on our website. Just go to WLTX.com.